typical patient with sickle cell disease is in pain at home and has to make a decision, do I come to the emergency department for that pain or not? Most of the time, patients in pain with sickle cell disease decide not to come to the emergency department. Patients admit staying at home because they think they won't get the right care if they come to the hospital. They admit staying at home until the pain is unbearable. And we know from neurobiology that's the exact wrong thing to do. You should come early so that you get on top of the pain. Now, the other half of this is physician decision making. How are physicians managing the patients when they arrive in the emergency department? The use of opioids, the use of nonsteroidals, the use of other pain medications. We have guidelines now about what should be done, and we have a ton of studies that shows what should be done is not what is done. And we have a ton of studies that show bias in the way physicians decide to treat patients. It has a lot to do with their own cultural background and their own biases that they bring to the table. And it has a lot to do with the systems of care that they find themselves in. And it has a lot to do with the way that they view their own careers and whether they think they will be chastised by external groups for things like using opioids. Physicians and patients each are responsible human beings, and the responsibility for my behavior as a patient is just as important to focus on as the responsibility of the physician for their behavior. Now, is there an imbalance in power in the relationship? You bet. But are they both important parts of the equation of good pain management and good patient care? Yes. And if each plays their part, you're going to get much better pain management than if only one plays their part.